everyone, we are from Team 5. We are going to present about COVID-19 and readiness in the future, especially it's about vaccine supply chain. So are we ready for it? The first thing we are going to talk about is about technology and vaccine supply chain. The second one is about technology and medical industry. The third one is about proactive government to cope with it. And then the last one is about readiness of society in the future. So I'm going to talk about the advanced technology for vaccine supply chain in the future. The first technology that is gonna help for the future vaccine supply chain is IBM. IBM is offering governments and private companies supply chain and open blockchain technology to record and authenticate the temperature and handling of each vaccine dose. The second one is Google. Google's cloud unit is assisting with vaccine intelligence and distribution. It's working alongside partners to deploy vaccine management solutions with state and local governments. The third one is from Oracle Corp. Oracle Corp is donating a national electronic health record database and public health management application that the government can use to track vaccinations and side effects. The fourth one is RFID. RFID Mobile Track and Trace provide detailed monitoring of vaccine shipments from the manufacturing plants to administration sites. And then the last one is IoT. IoT sensors. This helps and being used successfully in biopharmaceutical logistics. Can continuously check transit temperatures and flag any issues during the transit. And for the next slide, it's going to be presented by Chetan.
Thank you, Giovanni, for introduction. And now I will be elaborating on the technology part of how it is helping the medical industry to get prepared for the future. So first, we have now a web-based intelligence surveillance system. Each country is having their own ample amount of database through which they can help in early detection of these pandemics. At every level of primary and tertiary healthcare sector, data is being recorded and updated regularly. We have a lot of data to do research on and which can help us to be prepared for the pandemics in the future. Second, telemedicine and referrals. Nowadays, online consultation is being provided by doctors through the power of internet. For instance, as we arrived in Canada as international students, we were given some self-testing kits which were directed by the doctors through online consultation, so that how we can self-diagnose ourselves for the symptoms of COVID-19. Third, it's digital contact tracing. Through the power of technology, now we can actually trace where was the source of the pandemic, because people are moving very frequent now and then, even in their home country or across the countries. So now it is really very easy to digitally trace if a person is having symptoms of COVID-19. And now the countries are prepared how to tackle these type of events in future. In second part, we can see that how these digital uh, strategies and the technology has transformed our preparedness for pandemic. For instance, we have a lot of smartphone applications which can constantly access your health and the people who are nearby in your vicinity. If someone is having symptoms or how many healthy people are around you. Second, we have wearable technologies such as smartwatches and a lot of applications to track your own health. So they can show you your heartbeats or how much you have to walk, what is the sugar levels of your in your blood oxygen. Everything is now on your tips. Third, we have artificial intelligence and machine learning. That's how we can create these ample amount of data and intelligence systems that we have available right now, which were not able to process before. Also, technology has helped in developing vaccines at much a faster pace than it was used to be before. Before, it used to take at least 5 to 10 years to develop a vaccine, but now due to COVID-19 and with technology, we are able to do that in within less than 2 years, which is a remarkable step. So next, I will transfer to Vishal.
Good morning, everyone. My name is Vishal Rohira, and today I'll be discussing the proactiveness of Canadian government to cope up with the pandemic in the future. As we all know that the newly discovered variant of coronavirus named Omicron is in the headlines these days, and the Canadian government has come up with various measures to cope up with it. Firstly, Canadian citizens, permanent residents, and people with the status under the Indian Act who have been in South African countries in the 14 days before travel to Canada are required to obtain within 72 hours of departure a valid negative COVID-19 molecular test in a third country before continuing their journey to Canada. They are also required to complete testing upon arrival to Canada, regardless of their vaccination status or having had a previous history of testing positive of COVID-19. They are also required to complete a test on day 8 after arrival and quarantine for 14 days after their travel. Apart from this, there have been an increased scrutiny of quarantine plans for travelers from these countries and rigorous monitoring to ensure travelers are complying with the quarantine measures. The Government of Canada has also increased its capacity to find and track variants of concern in Canada by investing $53 million in an integrated variants of concern strategy. As of today, vaccination is required for travel within and out of Canada. A valid COVID-19 molecular test is no longer accepted as an alternative to vaccination unless travelers are eligible for one of the limited exemptions, such as medical inability to be vaccinated. Finally, ArriveCAN remains mandatory for everyone, regardless of if travelers enter by land, air, marine, or how long they were away from Canada. All travelers must submit their mandatory information in ArriveCAN app, including proof of vaccination and a quarantine plan before arriving in Canada. So thank you. This was my part, and now Zoya will continue with the presentation.
Thank you, Vishal. As you are taking over from him to present next point. Calm and the corporate society to handle this situation in the future. Okay, let's see the people affected by consequence of the COVID-19 pandemic result. Fear of the future, fear of the going to hospital is people is affected in the peoples we can see, and then after that, and the depreciation and the having to do more things at home, and purchasing power, and this feeling that no one is helping you. It is all about the people's feeling. Next graphic is about the stress factors reported by millennials worldwide during the COVID-19. So we can conclude that from this graphic, people's most stressing factors are worried about our loved people and long-term financial situations. And last stress factor is the political and social climate and physical mental health. So we can conclude that family and the finance situation is the most important stress factor. Some researchers, such as the Evan and Harper, reported that all people already learned about a new normal lifestyle. That means that people already learned to join in the culture and art and nature from home. Next point is World Health Organization called on the countries to work together to reboost international health architecture. In other words, they call that the countries take a start international health structure. Conclusion that is above all informations and technology, COVID-19 is affected to improve of technology, especially medical industry and government sectors and society. We can conclude that we are ready in a future big wave. Thank you so much, and it is our reference. Thank you for your attention.